Live from the SABC's Auckland Park studios, welcome to this evening's episode of The Watchdog. My name is Vuyo Mvogo, and on the show tonight...
Honorable members! Order, honorable members!
After chaos erupted in Parliament today as MPs were debating whether or not Cyril Ramaphosa and the rest of his cabinet should go, the president and his executive have survived. We tell you how it all went down. With more than 92,000 unused COVID-19 vaccines expiring tomorrow and now going to be destroyed, we talk to the people at the forefront of the government's vaccination efforts about what can be done to avoid a repeat. And after at least 7 children died of malnutrition in the Eastern Cape, we ask why and who should be held accountable. All that coming up in tonight's episode of The Watchdog, which starts right now.
Order. Honorable members. Honorable members. Order, honorable members. Honorable Shivambo. No, honorable members. No. All I am requesting is mutual respect amongst ourselves. Yes, somebody had occupied a seat.
Scenes from that parliamentary sitting this afternoon as MPs kicked off what were supposed to be 2 debates. One meant to pass a no-confidence motion on the head of state and another on his cabinet. Natasha Matsoni is the DA's chief whip and joins us on the line literally minutes after that, or the second, I should say, debate ended. Ms. Matsoni, thank you very much for your time this evening here. The Speaker, in particular, had her hands full this afternoon.
She most certainly did, but this is what happens when you have a chaotic voting system taking place. I must say that we had 65 different options of electronic voting that we presented to Parliament. The DA itself presenting the OPA vote system, which we used very well in our Congress, but unfortunately all suggestions were ignored and we went with a manual voting system. The chaos that erupted at the beginning, completely unnecessary. Just one member occupying the incorrect seat because it's quite difficult to know where you're supposed to sit with the new COVID regulations, but thankfully we managed to stop it becoming a physical altercation. But yes, the Speaker certainly did have her hands full, and you'll see the EFF quickly jumping up, pushing Mr. Khaleb Kachalia around. I will be laying a charge of assault against the EFF members in question once I have a very clear video of what happened. And unacceptable that in the Houses of Parliament we find it okay to push and shove when you could just ask a member to stand up and go and sit in another seat. But that's not what we were there for. We were there for a motion of no confidence. The DA was for a motion of no confidence in the Cabinet. And we stuck to our order of business. You will see that I intervened once I saw things getting physical. I suppose it does help that I'm 6'2" and about 180 kilos. So I do manage to stop these fights from erupting. But a very unfortunate way to start a historic day in Parliament.
Any idea how it all started?
Well, it started with, as you can see, seats are mixed. So it really just depends where the members are sitting on that day. And you can see that there's large gaps in between us. And the EFF felt that Mr. Kachalia was sitting in one of their seats to be occupied, but it had no name on the seat. And we quickly organised Mr. Kachalia another seat. And we managed to stop things from getting out of control. And as you can see, the two DA whips get up straight away. I think there you can see me arrive, and I put my hand in the middle of everything because I didn't want any punches to be thrown. And that's what a chief whip does. We stop trouble from going further than it needs to go.
Very quickly, I mean, who are you going to lay the charge with, and what's the allegation?
I'm going to be laying the charges with the Powers and Privileges Committee because you may not attack or physically touch another member of parliament. And as you can very clearly see, Mr. Kachalia was manhandled by Mr. Shivambu and other members of the caucus. There are different angles of the video, and I'm going to be interrogating all the angles of the video. And I will be reporting Mr. Shivambu for assault on a DA member to the Powers and Privileges Committee.
Now, about, 3/4 of an hour was spent on the first motion, which was the ATM motion that really never took place. And I remember at some point seeing you standing up, trying to put forward your position on the matter as everyone. And in fact, there seemed to be as many opinions, of what the legal position is as there were people, who stood up and spoke on the matter.
Yes, well, look, as you know, I'm a mere matriculant, but when it comes to the rules of parliament, I help draft them, and I'm an expert on the rules of parliament. And Rule 89 discusses what is sub judice and what may be discussed when an issue is sub judice. Now, we had already been contacted by the ATM the night before, and I explained to the ATM that we would not be supporting their request to have their motion heard on the basis of sub judice, because the sub judice rule is actually now been changed to such a degree that the Rules Committee is going to have to relook at even the way it's written in our rules book. And secondly, the matter under discussion was not sub judice in any way, because what the ATM went to court for was a secret ballot. And we were not discussing the process of how they were going to vote or whether the secret ballot would be heard. The ATM wanted the entire motion to go forward. And I explained in the 1 minute that each member had that we were not adhering to Rule 89 and that there was absolutely nothing sub judice because the item is actually off the roll. As soon as the judge declared it not to be an urgent matter, it ceased being on the roll of Parliament, on the roll of the court rather. So there was nothing sub judice about the issue, and you could not use the sub judice rule.
Now, of course, let's then come to your motion, which has fallen flat, 231 against, 131 for, and 1 abstention. Do you think that in spite of the defeat, you made your point, as your leader John Steenhuisen said, would be his view in the event what happened this evening actually happened? Which it did.
I think yes. I think we did make our point. The fact of the matter is we have a cabinet that can only be called the poverty cabinet. We have cabinet ministers who are unfit and improper to hold office. After the Zondo Commission, some shocking revelations coming out about many of the ministers. And we simply felt that we had to come out. We had to speak on behalf of South Africans because this cabinet that we have is going from bad to worse. Decisions decisions are being made that are not in the best interests of South Africans. Unemployment is spiraling out of control. As you know, 7 children died of malnutrition. Electricity prices out of just completely absurd. Transport costs going to go up again with the increase in petrol prices, food costs skyrocketing, and unfortunately our parliament went up in smoke, and if we don't do something about this inept cabinet, I'm afraid the country will go up in smoke as well.
Well, are you disappointed, though, at the fact that you couldn't get higher numbers? And how much of the responsibility would you take? And I'm asking this on the back of having listened to certain parties who, had the same concerns, were raising this, like similar issues to yours, but still fell short, of voting with you. Do you think there's something that perhaps you should be looking into as the Democratic Alliance in particular, to say, why would people agree with us so much, but, not want to vote with us?
I think, the problem is, and always is in Parliament, that we have a problem putting political ideology aside and putting South Africa first. Our president himself once said that he would always put the ANC first, and that should never be the case. As members of Parliament, it is our duty and our sworn oath to always put South Africans first. So, of course, I'm disappointed that we didn't get more votes. But what I would encourage you to do is go and have a very close look at the voting that happened with the ANC caucus, and notice how they were all in the same room, in the same venue, and it is my belief that they were kept in the same venue so that they would all vote in the same fashion. And I think that had things been done in a different manner, and had they allowed a vote of where you vote with your conscience to occur, I think the result would have been a lot different. But given the fact that we have a toxic environment inside Parliament, and given the fact that it's well known that if you would vote against the ANC in Parliament with one of their motions, you would lose your job, I don't think we could have expected a different outcome, especially the way the ANC were herded into a room where they were being closely watched by various ANC whips.
And that's where we're going to leave it. Let's thank you very much for your time, and at such short notice, Natasha Matsoni, who is the DA's whip in the National Assembly. After the break, at least 7 children died of malnutrition in the Eastern Cape. We ask why and who should be held accountable. To this rather sad story. At least 7 children have died of malnutrition in the Eastern Cape this year. Since January, 6 others have had to be hospitalized, and another 8 are fighting for their lives in a Lusikisiki hospital as towns and villages are battling one crisis after another. This is according to a report in the Daily Maverick. And tonight we are asking why and who should be held accountable. Wandile Ngapai is the Chief Director of Social Services in that province and joins us on the line. Mr. Ngapai, good evening. Thank you very much for your time this evening. When was, if I may ask, the first time your department came across, this information? Did you know it before it was published, or did you come to know it when questions were put to your department and a couple of others?
Okay. Basically, this particular story or case is as you indicated, is a case of malnutrition that's happening in the Eastern Ponderland of the province. We have been involved in intervening through teenage mothers over there for some time. But I think there could have been a miscommunication because this matter is a matter that is more under the health department. But we are more responsible as a department on the food distribution, which is social relief to address immediate needs of hunger, which is not necessarily a case of malnutrition amongst children, as you indicate in the case at hand. Thank you.
So you are saying you have, as that department, you have nothing to do with cases of, as it is put here, severe acute malnutrition affecting children in Eastern Pondoland, as you say.
No, I'm not saying we have nothing to do. I'm just saying the case of malnutrition or nutritious status on children is more a health competence. But we do intervene by interacting with the parents so that they are able, remember, children and child protection is a responsibility of the Department of Social Development in terms of caring for them.
Yes.
However, the issue at hand is the nutritious status. Our intervention is more on addressing the needs of hunger through our social relief programs, as well as to address protection of children, care and protection for children. But the areas that we are not specialists on is the nutrition aspect. Thank you.
Okay, maybe then I should ask you to, I mean, you've sort of outlined it very, very, very briefly, but on a day-to-day basis, what are the interventions you were talking about? What sort of things do you do in these communities? Are you the ones who go and identify the need, or are there other people who come to you saying, we've identified the need, you need to come in with resources? How exactly do you work?
Yes, it's a two-pronged process. At times we respond to a request. At times we go out through our field staff, which is community development practitioners and our social workers, to do what we call household profiling, which reveal to us the challenges that are experienced by the family members in that particular household in the local communities. And then we do referrals in that instance. But in the particular case of these villages, let me put it this way, we have interacted with young mothers because there were cases that were reported to us after the profiling revelations of the data gathered through that profiling, that there are young mothers who have children at a very early stage, and that some of these children are malnourished because of the circumstances. We then intervened through our programs, like for an example, assisting them to do backyard gardens, to grow fresh produce in the backyard gardens, whilst at the same time intervening by providing them with food parcels where there's a need or any other material needs that they need. I'm talking now the parents, the young parents of these children who were identified as malnourished. We of course partnered with various stakeholders in that area. Thank you.
Now, those of us who have never worked for government often battle with this, and I remember having conversations over the past years with colleagues who have to take charge of not only this institution, the SABC's coverage of these kinds of stories, but in the world of journalism broadly, as journalists who want to present to South Africa an accurate but very real a picture of what is happening in our country. One of the baffling things is never really putting a finger on why the government is, or those who are charged with those responsibilities of knowing what is going on, actually don't know. And here is why I am raising this particular point with you. If you look at the stunning work that Estelle Ellis has done in her piece, she quotes various figures, statistics, studies. According to the Provincial Department of Social Development, which is your department, it shows that in the Eastern Cape, an estimated 72% of the population lives below the poverty line. And this is considerably higher than the national average of 60%. And that's just your research. It comes from your department. Yes. And then she goes on to quote a separate study that was done only a year ago by Dr. Cheryl McKay at Doranginza Hospital, which concluded that there were serious problems with severe acute malnutrition in the province. She goes on to talk about risk factors that are identified by the study, another study, which is the Grow Great study, which talks about inadequate access to sanitation, not having birth certificates by the age of 5, not benefiting from a child support grant by age of 5, and so on and so on. Now, we're talking just from what I've said alone, we're talking 3 different studies, and one of them being your own report. Now, one wonders why then you would have to rely. I'm not saying, you shouldn't rely on the testimonies and people bring information to you, but you have a basis on which you can actually proactively address or at least deal with these issues.
Okay, no, thanks for you. You correct. Sorry about that. You correct. As a department, we have actually noticed that there are a significant number of households with no income. And as a result of that, we discovered that mainly during the period that the country was under siege through COVID-19 pandemic. And as a result, these particular households were struggling a lot to cope given the situation that at the time we found ourselves. We then made motivations to our Treasury and National Treasury, Provincial Treasury and National Treasury, for additional funding to be able to address such challenges. But of course, the challenge has always been the fact that the response would always come towards the end of the financial year, and you find it difficult to really put that into realization.
Which is why, and I want to come in there, and that's exactly the reason why I am asking this question, because I'm quoting your report and I'm quoting studies by other people. So by now, one would have thought you would know that because you have already identified this problem, that whenever you ask for help, it's probably a little too late because it's towards the end of the financial year. Why don't you then, in your cycle or budget cycle, prepare for that eventuality, because you have identified the problem already?
Yes, like I said, specifically on the targeted teenage parents or young mothers in the area of the eastern region in the province, we already have an intervention that is driven through our community development program, specifically assisting those households with preparing at their backyards fresh produce. We are assisting them to that. But the point, of course, is that there is this is a huge undertaking in terms of the number of people that really are affected. But the point is that it's not as if we are folding our arms and doing nothing. There is an intervention that we're doing in there. The various stakeholders in that locality are aware of it. But however, this is a matter that demands a collective action by various stakeholders and various government departments, which we are attempting to do as government. Thank you.
Okay. Now, for those of us who really don't understand the separation or demarcation you were making at the beginning, that nutrition issues are health issues, and you are dealing with food, social relief, and so on. As a lay person, I'm regarding, malnutrition as the worst form or case of hunger, which you said was your competency. In situations like these, where we can't be, held back, or stopped from doing something simply because it's someone's competency. In fact, one would argue from a layperson's point of view that, the bulk of what has come through this article actually falls within your lap. What have you done now that you know what has been written here? Or what are you going to do?
Okay, immediately we received this information as a department. We conducted various counterparts, health included, because you must understand we need to be guided on the items that are suitable to boost the nutritional status of a child or any other person. And that therefore needs a specialist to provide us with that. We even in the interventions that we're doing there, we have a range of other stakeholders that are coming into the party to assist us with. We are already now putting together a proposal that is going to assist towards ensuring that we make a major approach and a major intervention in that area, particularly now that there are these cases that have been reported already.
Okay, Mr. Ngapai, let's thank you for your time this evening. Wandile Ngapai is from the Eastern Cape Department of Social Development. On the back of that very painful story where 7 children in the Butterworth area in the Eastern Cape have died since January. 6 others had to be hospitalized. Another 8 are fighting for their lives in a hospital. In a country like ours, with the kinds of monies that get thrown around, given to people, who don't do anything at all, no child should should sleep without food, let alone die of malnutrition. Well, we'll see how this particular one pans out. Well, to this story now. Between tomorrow and the end of July, more than 6.6 million vaccines may have to be destroyed in this country after reaching their expiry dates. Well, the first batch, of course, would have to be destroyed, tomorrow or the day after tomorrow. Well, let's find out if anything is being done or may be done, could be done, will be done to avoid this kind of thing happening in future. Dr. Nicholas Crisp is the Deputy Director General in the National Department of Health. He is responsible for the country's vaccine program. Chris Vick is the chairperson of COVID Comms, an organization of communicators that has joined hands with the government to assist in dealing with the pandemic. And today they had a workshop where they were looking at things that have worked and things that have not worked in how we have dealt with this pandemic as a nation. Gentlemen, good evening. Thank you very much for your time.
Good evening. Thanks very much for having us.
Okay. Dr. Crisp, I'm going to start with you, if I may. In the statement the department released yesterday, I'm keen to understand why a communications team felt the need to underscore things like, the disposing of unused medicines is nothing new and happens on a regular basis. Also, the volume due to expire is equivalent to 0.24% of all Pfizer doses received, and therefore, under the World Health Organization, 10% is an acceptable ratio of vaccine waste. Was that your way of shielding yourselves from criticism?
No, these are responses to questions that we've been asked repeatedly. This has been in the public domain for more than a month already. Those are just copies of old statements that have already been made. We've been completely transparent about what's happened because it was part of our campaign to try and encourage people to come for vaccination. At the stage when we put out the first notice warning people that we were going to have to dispose of vaccines, we already at that stage had more than 300,000 doses that we were worried about for now at the 31st of March. And we were able to move some of those into vaccination sites and use them. And we've been able to move all of April's expiring stock into vaccination sites to use them. So we have been limiting the damage. It's almost 6 weeks since we started working in earnest with COVAX and others to try and donate our vaccine to other countries. But unfortunately, the first world has left us on our own. And just this evening, I've received requests from other countries, all in similar positions to ours, who have now been left with large numbers of vaccines, some donated, some that they bought, like us. This is largely donated stock as well, that is now going to expire because it is not used. So we have a number of ways to deal with it. The one is to try and encourage people to take up vaccination. Obviously, that's what we are desperate to do. We know that COVID is still amongst us. It's still a threat. No matter what other people are telling you, we have not seen the end of this yet. And people who think that because they had COVID, they have sufficient immunity should be advised that that is not the reality. You need to be both vaccinated and have had natural infection or have had a full course and a booster of vaccinations. Otherwise, you are not protected.
And we are going to get into those issues in a bit, but I just wanted you to finish that thought, just so that we understand exactly what you meant. When you spoke about what the first world has done to us, what exactly did you mean? What's the problem there? What's the issue?
So what happened at the start of the pandemic is that we had to compete very hard to get vaccines. And we realized, and not us ourselves, I mean, there are countries all over the world. And as I say, there were other countries we were aware of today who are in the same boat as us. So we realized we would have to procure once off, and we had to sign contracts for the whole term, for everything, for all our vaccines. And we signed 2 contracts, one for Pfizer and one for Johnson & Johnson. And as everyone's aware, Johnson & Johnson then was unavailable for months while they were in quarantine, lockdown for infection in their plant. During that period, the United States government donated over 7.5 million doses to us and helped us. But now we sit with all these vaccines in third world countries that are not being used because we're getting to the end of the pandemic. And all the first world countries are continually still trying to donate to us their excess stock. And we are trying to donate ours to other countries. So it's become a global mess of a vaccine glut at the moment, with people believing that the pandemic is over and not coming for vaccination. Every vaccine dose is not just a waste of money. As a public health medicine specialist and as people in the public health system, this is it's a disaster. Every dose is a complete waste of an opportunity to protect somebody from infection. It's very sad.
Chris Vick, you're part of this group of more than 40 of the country's top communicators who today met to look at the successes and failures of the communication campaigns during this pandemic. Let's start with the successes. What do you think went extremely well during the past 2 years we've had to deal with this?
Thanks, Will. I think that the people who...
Okay, we don't know what happened now. We can't hear you now. We heard you at the beginning. I don't know if you accidentally muted yourself.
Can you hear me now?
Yes, we can hear you now. Yeah, great. You can go ahead.
Thank you. As I was saying, thank you. The workshop brought together people from civil society, labor, business, and government who've been working on communication around the pandemic since day one. And there's an increasing feeling that we are getting better at what we're doing, that the communication is more effective, it's happening in plain language, and that we're using all South African languages much more than was the case in the beginning. Having said that, though, we did lose a lot of time in the communications effort, partly due to some of the difficulties with digital vibes and other developments. But the sense coming out of the workshop itself was the success, in a sense, is that all four social partners, civil society, government, business, and labor, are able to work together on a daily basis, coordinating messaging, coordinating the rollout of communication, and increasingly getting that aligned to the rollout of vaccines as well. So much more effective and much more efficient than we were this time last year. I'd say that was the key success. There were some significant failures that we discussed and some very good suggestions around how to do things better. But I'm sure we'll come to that.
Well, did you discuss at all the less than optimal uptake when it comes to vaccines? And did you regard that or classify that to be among the failures of our communication effort up until now?
Well, there was quite a lot of input and different ideas. And organized labor, for example, made the point that from the get-go, we probably underestimated the number of people who don't want to get vaccinated. And we probably made some mistakes in not fully understanding why people aren't getting vaccinated. But obviously, there are issues like trust deficits in government, in business, which have impacted on this thing. The delays in the vaccines arriving. Dr. Chris goes out of his way and is very successful in explaining the complexities of acquiring vaccines, etc. It's a massive logistical exercise, and to communicate the modalities of that exercise in itself is very challenging. But add to that suspicion, misinformation, and a sort of apathy towards science, and you have quite a toxic environment in which to communicate. But as I say, I think there's increasing awareness of the impact that's having, not just on the effectiveness of communication campaigns, but on the effectiveness of vaccine rollouts. Just an additional point, we're also finding increasingly that there's almost a fatigue that has developed around COVID, and a fatigue around COVID communication. So there's a lot more work going into more innovative ways, community mobilization, aligning communication interventions with vaccine rollout, so that you could have a workshop in a community tomorrow around building an understanding where people can ask questions about vaccines, and the very next day you have a vaccine site present, so that you're integrating that contact and communication with the actual rollout of vaccines.
Dr. Crisp, do we still not fully understand why people don't want to vaccinate, as some people suggested at this workshop?
I think there are many things we don't understand about COVID, and I guess there are many things we don't understand about the way our patients interact with the system. We're quite a diverse society, and it's quite difficult to understand all the components of that society. I mean, I'm not a professional communicator, so I do my best to talk and try and convey information in an uncomplicated way. But when we talk to the communicators, they also sometimes are flummoxed about why certain things happen. So I think that there are two sides to making any healthcare available, and particular vaccines. One is the accessibility of the product. So how do we get it close to people that it's not a hardship for them to come to us to get the vaccination? The second one is people need to really want to get that vaccination. So when there's a threat, they come in their numbers because they see friends and family getting sick, and it's a protective mechanism. But once the threat goes away, as Chris said, there's a fatigue, and people are tired of masks, they're tired of us, they're tired of government, we've in their face, things have really been tough, people have lost their jobs. So in that environment, to communicate and to understand what it is that's bothering people is difficult. And then there's the added challenge of people who are spreading false information. They spread pseudoscience, and it's very easy with social media to get to a large number of people and create confusion in a very short space of time. So I'm sure we have a lot to learn, But our bigger worry as health professionals is there are a lot of people out there who are not protected or who are inadequately protected. And should we get a more vicious fifth wave, we will be back in where we came from. And that's our big concern, because we really don't understand how to predict what this virus is doing by way of variants. So, I just want to appeal to people. Now is not the time to let your guard down. It's the lull in the battle when you need to collect your armor and get your protection. It's always like that. And this is the time to get vaccinated.
Chris, in your conversations today, did you at all sort of get to discuss, in the face of the wave that, people like Dr. Crisp have been talking about, and in fact that everyone agrees that, it's not if but when. Did you manage to discuss how to then, or whether in fact a communication or better ways of communicating can deal effectively with the misinformation you were talking about, the trust deficit, the fatigue, and all those things? Chris?
In terms of the misinformation, I'm sorry, can you hear me? There's a bit of a lag.
Yeah, that's fine. We can hear you.
We had a specific group looking at misinformation, and Prof. Moshabela from the University of KZN was very instructive about mistakes that have been made in the past in almost alienating people who don't want to be vaccinated, whether they're vaccine hesitant or vaccine resistant. So that I think you're going to see a stronger push to persuade people who are hostile or resistant to vaccination to become less hostile or resistant. So a less combative posture, if you like, between what are called anti-vaxxers and people who are pro-vaccination. Prof. Moshabela also made the point, which was well received, that possibly people are not taking vaccines out of protest at the state in general. He gave the example of a young man, for example, who is unemployed, feels the state doesn't have an interest in his future, and therefore any intervention by the state is rebutted or rejected. It's difficult to know how widespread that is, but there's a combination of factors, obviously, that are coming into effect. In terms of dealing with the fatigue, the discussions today focused on more segmented approaches. So not looking at a one-size-fits-all campaign. You'll have seen lately a lot more of government communication is aimed specifically at young people. And I think that's an indication of that segmented approach that I'm talking about, but also really increasing the amount of indigenous language communication, particularly on community radio, the African language stations of the SABC, to get the word out in language that is people's their mother tongue, is more effective than having highbrow scientific English communication. So there's a range of initiatives, but the one that COVID Comms is busy with, along with the Community Constituency Front and the South African Council of Churches, we're developing toolkits for community leaders that enable them to deal with vaccine hesitancy, to explain how the vaccine was made, to explain the benefits, to explain away some of the myths. And that direct contact with communities, I think you're going to see a lot more of. And in our case, because we're communicators, we film those workshops, we film that testimony, and we put it on our social media platforms to try and amplify the message. So although there might be fatigue around COVID and COVID communications, there's certainly not fatigue among the group of people who are at the workshop today around the need to keep doing the job.
Dr. Crisp, 92,370 unused vaccines are expiring tomorrow, and those will have to be destroyed. Now, is it a foregone conclusion that the other 892,270 that will expire in May and the 845,800 that will expire in June and the more than 4.8 million that will expire in July would expire? Or will that depend on the work that goes into the effort now to get people vaccinated? And if people come in numbers, if people like Chris Vick and the effort that they are putting into it become successful, we'll be able to avert that situation.
Yeah, so maybe it's useful just to explain what the expiry means. All vaccines and all medicines have expiry dates. Just like the food you buy in the supermarket, everything has got an expiry date. With vaccines and with medicines, we don't extend the expiry dates because there's a chance they won't work, and there's a chance that they will be bad for you. So we don't want to take a risk that there's some danger associated with using any medicine after the date that has been set by the manufacturer. So the way in which the vaccines work is they come into the country to central stores at minus 70 degrees. I'm talking now about Pfizer vaccine. The Johnson & Johnson vaccine only starts to expire in more than a year's time, so in 2023. So we are talking now about Pfizer vaccine, which is stored at minus 70, and once it is thawed, once it comes out and it goes to lower temperatures, you can't put it back into that minus fridge, and it starts the countdown towards that expiry date. So once we reach the expiry date, if we have not used the vaccine, it has to be disposed of. So it's not a foregone the expiry is a foregone conclusion. The disposal or the destruction of the vaccine is not a foregone conclusion. That if we are able to pick up the numbers that we vaccinate, we will not need to dispose of any of it. So that's really the challenge. So that's what I was saying earlier. The March expiry, the stuff that expires tomorrow, is the remaining small portion. It's 92,000 doses out of what we've vaccinated so far, 33 million doses, that will expire without being distributed. That's the problem. We do also lose vaccine to waste in the periphery, but it's very small numbers. And those are when at the end, towards the end of the day, a vial is opened or taken out of the cold storage, and we can't put it back, and we have to discard it at the end of the day. So you do sometimes, in fact, you usually lose a couple of doses at the end of the day, and that is unavoidable waste. It's the avoidable waste, this big central oversupply, which is devastating for us. We really, really can't have vaccines that could protect people be going to waste. That's very sad.
Dr. Crisp, I want to squeeze in just one tweet, because we're trying to encourage people, to engage in these conversations. We have Shamin Smith, who says about the 6 million vaccines that need to be destroyed. Would be interesting to know the expiry dates of doses donated by the global north. My bet is on old stock dumped on developing countries to deal with as usual.
Yeah, so I mean, it goes back to more or less what I was saying earlier. So during the period where we had no Johnson & Johnson vaccine, and we're entirely reliant on Pfizer vaccine, you will recall at that time we ran out of vaccine in several sites because there just was more demand than there was supply. And at that stage, the United States government donated a lot of vaccine to us, 7.5 million doses. That vaccine had a proper expiry date of more than 6 months, but I don't know if it was as much as 9 months. When Pfizer vaccines manufactured, its expiry is 9 months. So we buy in batches that are extending the expiry dates as we go. What is happening now is that countries have surplus and they are trying to offload their surplus. And so we get offered by all over the world at the moment that because we have a surplus ourselves, we now are trying to give it to other countries. And we don't want to be accused of the same thing, of giving it to our neighbors now with only 2 or 3 months to expiry. So we are caught between a rock and a hard place at the moment.
Okay, Dr. Chris Vick, let me thank both of you for agreeing to come on this evening. As you have heard, ladies and gentlemen, we're not out of the woods just yet. There's a wave that we are facing, so do take care and be responsible and go and vaccinate. That's our show for this evening. To join us again tomorrow night, same time. Have a good night.